Hello, my name is Ginny Hanrahan and I am the CEO and Registrar at CORU. Thank you for joining this virtual launch of our new Statement of Strategy 2022 to 2026. Today is a landmark day in the history of CORU as we launch our new 5-year Statement of Strategy. This blueprint will guide us over the next 5 years and sets us on the path to truly becoming one of the most important and influential organisations within Irish health and social care. In a few minutes, I will outline many of the practical steps and efforts CORU will undertake in the years ahead. But first, it's my honour to introduce the Chair of the Health and Social Care Professionals Council, Mo Flynn. Mo, who previously served as a member of the Council from 2014 to 2019, was appointed Chair in 2020. Since that time, she has been instrumental in guiding the creation of this strategy with a laser-like focus on our core priority, which is, of course, protecting the public. Thank you, Mo.
Thank you, Ginny. I too am delighted to welcome everyone and to have the opportunity to formally launch this new statement of strategy for CORU. CORU has for many years now been playing a key role in protecting the public. The importance of this work cannot be underestimated. The level of accountability and transparency demanded of health and social care professionals by patients, service users and the wider public has increased significantly in the years since CORU's establishment. This is an incredibly positive development and one we wholeheartedly embrace. It encourages the professions to consistently deliver the highest standards of care, thereby ensuring greater protection of the public. This statement of strategy has provided us with the opportunity to reflect on the past and plan. I am delighted we are launching it today and pleased to share our priorities with you. At the outset, I must acknowledge the Trojan work of our registrants throughout the pandemic. Health and social care services have been severely impacted. Our registrants have continued to provide care and treatment to the public despite risk of infection, fear of transmission to family members and friends, and unprecedented restrictions. Throughout the pandemic, they have been the embodiment of professionalism and demonstrated tremendous dedication to their patients and service users. The country is indeed better off for their efforts. As we are now emerging from that period of intense disruption and uncertainty, there are many new challenges health and social care must address. As the regulator for these professions, we must evolve and adapt to meet new challenges. In developing this new strategy, we have reflected on these challenges. We have considered the environment in which we find ourselves today, so that we can anticipate how our regulatory models need to respond tomorrow. An ageing population is a key consideration, as this is changing care demands across many of the professions we regulate. Broader healthcare trends from epidemiology to lifestyle risk factors are also having an impact. Ultimately, this will all contribute to an increased demand for health and social care professionals. CORU, as the regulator, must be ready to facilitate this. This increase in demand will likely result in a further shortfall in the health and social care labour force. In the short term, we are likely to see a continued need to recruit from overseas. CORU must support professionals that move to Ireland from overseas without friction. But we must balance this with our absolute requirement to ensure that everyone registered to practice in Ireland has the required competence and skill. Healthcare in Ireland as a whole is changing at an increasingly rapid pace. For example, the increased role of technology and the implementation of sláinte care. This all means that the provision of health and social care in this country will be very different in 2027 at the end of our strategy when compared with 2017 when our previous strategy commenced. Changes in the demands on how and where services are delivered by our registrants needs to be reflected in the standards we set. For example, we must ensure that our new graduates are digitally enabled and are prepared to work in the sláinte care approach to developing more community services and lessening dependency on hospital services to support delivery in the growing demands on services. Arising from these challenges, we envisage significant opportunities as we continue to evolve and expand our role in the coming years. In developing this strategy, we undertook widespread consultation, and this has helped us to redefine our purpose and our aim. These are the guiding principles that we strive towards in everything that we do. In defining our purpose, we say that CORU is Ireland's multi-professional health and social care regulator. Our role is to protect the public by promoting high standards of professional conduct, education, training and competence through statutory registration of health and social care professionals. While our aim is to promote high professional standards to deliver quality health and social care services that will ensure public protection. In examining our operating environment, both external and internal, and in reflecting on this purpose and aim, we have identified 5 key strategic priorities. First, we will progress regulation of the 6 remaining designated professions. Second, we will ensure regulation protects the public and supports health and social care professionals. Third, we will build organisational capacity while evolving a more sustainable regulatory model. Fourth, we will increase awareness of our role to the public we protect and the professionals we regulate. And finally, we will anchor our regulatory interventions in evidence-informed research and insights. This strategy sets an ambitious plan over the coming 5 years. Its implementation will transform our organisation and deliver a more sustainable model of regulation. One that is more efficient, but crucially, one that maximises our ability to protect the public. Achieving this will mean significant changes for the structure of CORU that I'm sure you will recognise are required. My priority, and that of Council, must be to build a more sustainable regulatory model. Our current model of regulation is too complex. This poses some challenges and is not in the best interests of patients and service users or the professions themselves. There are currently over 120 statutory meetings managed each year by CORU. This requires a large amount of executive support, which is time that could be more effectively deployed elsewhere. Due to the large number of people who give voluntarily of their time as members of registration boards and council, this leads to a turnover of members as terms of office expires. This creates risks as we lose regulatory knowledge and expertise. Establishing a new governance structure will not happen overnight. But we are committed to progressing work to design and test a new model. This will involve further engagement and consultation with all our stakeholders in the years ahead, and we look forward to hearing your views. Finally, before handing over to Ginny, I want to thank the executive team at CORU. CORU exists to protect the public. Every one person in Ireland will require the care of CORU registered professionals at various stages throughout their lives. And thanks to the dedicated work of the CORU team, we can all have confidence in the quality and consistency of that care. I am delighted, as Chair, to have the opportunity to guide CORU through its next exciting phase. Thank you.
As Mo has outlined in the plan, what we have set out in this strategy is highly ambitious. We were no less ambitious when we charted out the plan that would take us up to 2022. And I feel it is only appropriate to reflect on some of the achievements we have made over that time. The most obvious achievement is the growth of the number of registrants. In 2016, there were 8,000, and today that number has almost trebled to over 23,000. This was driven by opening of no less than 5 registration boards. With each new board and each new profession, we are able to protect more people. There is no duty more important to CORU than taking action to protect the public when this is required. Over the past 7 years, we have been progressing our Fitness to Practice programme. We are now reviewing dozens of complaints each year, and Fitness to Practice hearings are a regular undertaking. We have also successfully prosecuted a number of cases in public interest, including in 2020, a landmark case where 2 individuals were convicted for the misuse of professional titles that were protected by CORU. With the help of a new website and through widespread public information campaigns, we have improved the public awareness of CORU, work that will continue into the future. And internally, we have managed great change as well. We have now grown to a team of 75 people, and also, after many nomadic years, established a permanent home for ourselves in Smithfield in Dublin. And now to look to the future. I mentioned that today we regulate over 23,000 professionals, but by the end of 2026 we anticipate that this will grow to over 33,000. This growth will not be without its challenges, but the experience we have established within CORU provides us with a tremendous foundation to succeed. As a fast-growing organisation, it is critical that we have a roadmap which guides our organisation in delivering on our mission to protect the public. The statement of strategy we launched today is that roadmap. As Mo outlined, it sets out 5 strategic priorities for the organisation. These priorities have been identified following extensive consultations. It builds on previous statement of strategy and will best position us to achieve our organisational goals. First of all, we must deliver on our legislative mandate. This will require us to progress work to open registers for those professionals designated under our Act that are not yet open. There are 6 professionals, clinical biochemists and orthoptists, are currently in the pre-establishment phase where a registration board is yet to be appointed by the Minister for Health. While extensive work has already been completed for counsellors, psychotherapists, psychologists and social care workers. We expect to open the Social Care Workers Register on the 30th of November 2023. And our work continues to progress towards opening the other registers. Our second strategic priority is to ensure regulation protects the public and supports health and social care professionals. We have committed to increasingly shifting our focus towards an upstream model of regulation. A growing number of evidence highlights that encouraging and supporting registrants in their practice has the greatest impact on public protection. We will always deal with complaints, but these are exceedingly rare, and so it is appropriate that we focus our resources on prevention of problems wherever possible. Our third strategic priority is to build our organisational capacity while evolving a more sustainable regulatory model. As Mo has identified, this is an absolute necessity. 10 years ago, when only 2 registration boards were established, it was recognised that the current governance of CORU was unsustainable. This has only become more apparent as we continue to grow and expand. We will review our current legislation regulating health and social care professionals and recommend changes to achieve a sustainable model of regulation. A fourth strategic priority is to increase the awareness of our organisation and our role to the public we protect and the professionals we regulate. In order to protect the public, it is essential that they know when things go wrong, as they sometimes will, who they should turn to for help. To support this, we will undertake an awareness survey to establish understanding of CORU's role and to inform our communication strategy. We will promote awareness not only of the role of CORU but also of the value of our regulated health and social care professionals and their contribution to safe and effective care. Regulation is ever evolving, as is health and social care service delivery and professional practice. We are committed to ensuring our regulatory pillars remain appropriate and relevant to protect the public. Council has identified that we will anchor our regulatory interventions in evidence-informed research and insights. This is the fifth priority in our statement of strategy. Our plan highlights 32 key actions, and I've had the opportunity to mention just a few. We've also defined what success will look like, identifying a dozen key achievements. These include reviewing our standards, codes and guidance to ensure they remain appropriate and in line with emerging evidence, progressing a sustainable model of regulation that allows greater agility, and that we have identified a sustainable funding model that assures adequate resources to meet our duty to protect the public. There is much work to do, and I, for one, am extremely excited to get started. Before concluding, I must thank all of those who've helped us to shape this statement of strategy. Through our consultation process, we heard invaluable contributions from registrants, employers, professional bodies, patient advocacy groups, education providers and union. I would like to thank them for their continued support in advancing our work for the benefit of everyone in Ireland who require health and social care services. We also wish to thank the Minister for Health and his department for their support, and in particular the Professional Regulatory Unit, and we appreciate their ongoing commitment and engagement in joining with CORU on its regulatory journey. Finally, I must acknowledge the many health and social care professionals who have been on the front line of our country's response to the pandemic. The Code of Professional Conduct and Ethics has never been more important in guiding their work, and I want to acknowledge their commitment to their patient and service users in a very difficult and stressful time. The statement strategy is now a live and evolving document and is available to download from our website, coru.ie. I would encourage you to read it. Please share your thoughts and feedback with us as we progress with our work. Thank you.